And welcome back. Thursday edition of Wave 3 Listens Live. We're coming to you from Corydon, Indiana at the Corydon Pain Management Clinic. Dr. Dunbar, Dr. Tornatore, and we are joined by a patient now. Jason Becker is with us. Before we chat with Jason and his personal experience here, you said something that really caught me here. You said, we're not a pill mill. I think some of us are not familiar with that term pill mill, meaning it's not going to be like we're going to throw a bunch of pills at you and see you later, right?
Right.
Okay, so there are, in other words, options. That's what it's all about, and really, truly getting better from the inside out, right?
Absolutely.
Okay. And Dr. Tornatore, do you want to add to that? Because I know this is something that's critical to you. Obviously, it's an issue that we talk about a lot in the news, but opioids, in the right instances, can be effective. But this is something that you got to take very seriously, right?
Yes, I totally agree. That's why we have a problem, right? So one of the things that we are looking at here in this segment is the stigma. And you're right, there is a stigma. In fact, when Michael and Gary were here initially, I was explaining this stigma. People think pain management is full of pill heads, and that is just not true today. I mean, those clinics are closed. The people who are left standing are the people in a low-dose model, and that's what we are, but we've been that way from the beginning. The stigma is just not a reality anymore, and there's a lot of people who are not getting the care they need because of it. And when we were discussing this location, we walked in here and a chiropractic patient came in and he said, "Get me off there, I'm not a pillhead." I just laughed and said, that's exactly what I'm talking about. It isn't that, and the people that come here are not that.
And I think that's a legitimate fear, because we've been, fed a lot of information that is accurate, but it's not what's happening here. A few clinics should not really be the face of all clinics, and here it is done in the correct manner with options. Each patient is different. It is not one type of treatment fits all.
That's right.
All right. I want to talk to you, Jason, a little bit about your personal experience.
Sure.
So tell me a little bit about the challenges you faced and how long have you had these issues?
I've been dealing with issues almost since I got out of high school. I've had a couple bad car wrecks. I was an athlete, had problems with that. But car wrecks and stuff, my neck and my back have really been a mess for a long time.
Okay, so I'll ask you, Dr. Tornatore, because you're probably familiar with Jason's case here. So a little bit about Jason. You talked about structure. Those are his issues, right?
Yes, and by the time he started, like he said, he's been having it since high school. Yeah. By the time we got to him conservatively, we look at it and the structure's already so damaged, and a lot of people are in that state. But even in spite of that, manual therapy and treating it correctly will preserve what's left of the joint, and hopefully it will keep other joints from getting like that.
So when did you know, because I think a lot of folks watching, when was that time when you knew I needed to call a professional? What was the pain just unbearable? What happened in your case, Jason?
Yeah, it got to the point where I couldn't sleep at night, had trouble just doing normal things you would do, like my son, going out throwing baseball and everything. It got to be, a major problem.
Wow, everyone should be able to throw baseball with their son, Everyone should be able to do that. So had you tried other methods? Had you gone to other clinics before you arrived here, Jason?
Yes, I'd been a couple other different places before I got here. But once I got here, I've been here 3 or 4 years now, at least. And I'm doing better than I ever have.
Oh, I like hearing that. That's what I wanted to hear, because it's one thing to ask the doctors, and I know what their goal is, but to ask a patient, are they achieving the goal? So when you say I'm feeling better, so the difference between the day you walked in the door and how you're feeling today, Jason?
Oh, yeah, it's a major difference. I still have problems that I need to take care of, a surgery coming up, but, I'm probably 85% better at least when I walked in.
I like that number.
Yeah.
Yeah, I like that number. That's a good outcome. That is a good outcome. So you have surgery coming up now. Will you continue treatment here at the Corydon Pain Management Clinic? You'll continue.
Yeah, I'll keep coming here as long as I need to.
All right. So. You're smart.
Yeah.
That's what you want to hear from patients. I think there are a lot of people, and I don't want to stereotype, but I would think specifically men who put this off. And the more that you quit putting it off, quit procrastinating, right? Because the sooner you can get to them, the better the outcome may be, right?
Right. And he's a perfect example of what we talk about. We're interfacing with his referring physician. I know his surgeon. His surgeon knows me personally. Operated on my sister-in-law, actually. So that's how tight the community is in Louisville and over here in Corydon. That we want to know everything about what's going on with him and his family, and that's why we can be successful in getting him better.
Okay. In regard to Jason's treatment plan, because I know there's a strategic plan. Dr. Tornatore, how do you two, you and Dr. Dunbar, work together on a patient like Jason?
We look at it from our side, the structure again, and we're going to try to free up joints. I mean, it's the biggest thing we can do is take degenerated joints and restore movement, because joints feed off of movement. It's kind of like a sponge, the cartilage in between. You squeeze the sponge, and then when you let go, it sucks up the fluid. It's called imbibition, but what it means really is if a joint has stopped moving, it's going to not get the blood supply and the nutrition that it needs.
Before I ask one more question of Jason, I want to ask you guys, we talked about that stigma. For those out there who may have this, stigma in their mind, and it's understandable, we've almost been, I don't know, for better, brainwashed, because we hear so much, and some of it is true, and some of it is alarming. But what would you tell someone who is apprehensive because they have heard that, about pill mills or opioids? What would you tell them, Dr. Dunbar?
I would tell them to be reassured that when they come to this clinic that we're doing the state-of-the-art treatment. We're all board certified by our respective boards. We have tons of experience. I've been practicing for over 40 years now, believe it or not. And we're doing everything by the book. We're not just throwing things at patients and hope that they stick and that they work.
That's right, state-of-the-art. I like that, state-of-the-art, and the state-of-the-art has changed. So again, it's the Corydon Pain Management Clinic. And Jason, before we go to break, I'm going to ask you, okay, you throwing baseball with your son again?
Oh, yeah.
Oh, yeah.
I actually did it last night.
Does he have some talent?
Yeah, he's really good.
All right.
14 years old and probably one of the best players around the state.
Wow, congratulations. Isn't that nice?
Yeah, hoping he gets to go to college somewhere and play ball.
and wouldn't it be a shame if Dad said, I could never really throw baseball with him. He was good on his own. So congratulations to you.
Thank you.
All right, once again, the Corydon Pain Management Clinic. We're going to take a quick break. We're going to talk a little bit more about opioids and dive a little bit deeper into the current state of pain management here at the Corydon Pain Management Clinic. We'll be back.